community, and I ask that you vote in favor of this bill. Thank you.
Thank you, sir. Mr. Daubert.
Mr. Chairman, members of the committee, my name is Tom Daubert, and I'm here on behalf of Patients and Families United. I've testified enough this session that I'm starting to forget to which committee I've said what. But I think you all know that I formed Patients and Families United around the end of 2006 because it was already clear to me that the law was not working as we had hoped and intended. And I think I've mentioned to this committee that I think we all agree there have been a lot of abuses and exploitations, problems caused by people exploiting loopholes and gray areas of the law. And the two big categories that need improvement clearly are concern the doctor recommendation end on the one hand, and I think we can all agree we think all recommendations need to be made in a medically responsible way, and we know who I might be referring to where I too allude to somebody who ran clinics all over the state that didn't do that. I think that whole category of problem is relatively easy to fix, and there are bills that have proposed improvements in that area. I don't believe this bill was intended to do any of that. But this bill was intended, and I think still would, address the other key area, and that is the clear need to regulate those who produce and dispense legal cannabis to registered patients. For the benefit of law enforcement, local government, as well as patients as well, we need that kind of strict regulation. Senator Lewis's bill, as introduced, I think offered the most rigorous approach of any bills I've seen so far. I have not had a chance to digest all the details in the new proposed version, but on first glance, it seems to fix many of the problems that I think we all thought the bill as introduced still had. And I think the key message I want you to hear on my behalf and the patients I work with is that we do very strongly support rigorous regulation of this industry. And we hope you will take this proposal seriously toward that goal. A couple quick comments on what my experience with patients over the last 6 years tells me patients need. Patients need choices. That means they need a diversity of options as to who grows, what they grow, what they produce. One of the flaws in the current law, unfortunately, is that the identities of caregivers is secret. Unless you happen to know who caregivers in your neighborhood are, or unless there are some who advertise, you're going to have a hard time knowing where to go. I'm not sure if this bill does anything about that, but the patients I work with think that if you want to be involved in this issue, if you want to be producing cannabis for patients, then just as law enforcement legitimately wants it to be accessible information where your plants are and where your businesses are located, you should be willing to be listed in some kind of directory with contact information so that any patient anywhere in the state could contact you to find out about your services, to better patient choice. Patients need diversity of strains, different kinds of plants. Every patient responds differently to every strain. Even two patients with the same exact medical condition will respond differently to different strains. They need diversity. That means we need a multiplicity of growers, and we need to protect the small ones who are existing now, as well as the large ones who are good. No one wants one Walmart serving all the patients. In hopes that this bill can be a platform toward fulfilling all those goals, I encourage you to work seriously with it. And also, finally, patients would certainly agree that, as the current law requires, taxpayers should not pay any of the costs of regulation or oversight for this program. It does need to be covered by patients and the producers themselves. And if there is going to be any excess revenue, we can think of no more fitting place for it to go than seniors. and related health services. Thank you.
Thank you, Mr. Daubert. Mr. Blatty?